Okay guys, welcome back to part 2 of the Discovery Changes for 2022. Still need to motor on. Enhancements to the trauma recovery extender benefits. So some of the plans did not have this. It's now going to be applied to all the plans, which is great news. And just have a look at what it does. It enhanced access to the trauma recovery and extender benefit. The benefit will extend to all plans. The benefit entry criteria have been amended to include a higher acuity admission in high care or any number of days in ICU. So if you have a trauma and you need to be admitted into ICU or high care, it's going to cover crime-related injury, near drowning, poisoning, severe anaphylactic reaction, and external and internal head injuries. There's also enhanced cover for counselling sessions. It's now up to 6 with a psychologist, social worker, or registered counsellor in the year that the trauma occurred and the year after the trauma occurred. And then it's available to all registered beneficiaries on the policy, so not just the main member, but all the beneficiaries. Right, the basic dental benefit, trauma benefit, so that's if you have had an accident or you've been on the field playing hockey and you got a stick in your mouth, or if you've had your teeth have deteriorated because of cancer, this will apply. So from January 2022, the scheme will introduce the basic dental trauma to cover urgent dental care for the patient. For partial or complete loss of one or more teeth as a result of a sudden and unanticipated impact injury, the scheme will fund approved dental appliances or dental prostheses and the placement thereof, commencing within 30 days of the injury. This benefit will be available on all Discovery plans except for Essential Smart and the Key Care plans. Clinical entry criteria, treatment guidelines and protocols apply, and there's a very nice limit of 58,000 per person following the injury or accident. Dyspepsia management is really just very intense heartburn, but it can be very dangerous because the gastric acid can eat into the bottom of your esophagus, requiring an operation. So currently the scheme applies a co-payment between 3,600 and 62,000 to inpatient gastrointestinal scopes on all plans except for Key Care, which only cover the endoscopic procedures. No co-payment applies to gastrointestinal scopes performed in the doctor's rooms or for children under 12 or for confirmed PMB or prescribed minimum benefit cases. In 2022, to promote the identification and appropriate treatment, provide members with options for full cover, there will be an out-of-hospital management program for dyspepsia, and it covers additional tests and medicines to treat the dyspepsia, and where a gastroscopy is referred and approved after completion of the treatment of the care plan, the scope will be covered 100% for the Discovery Health rate and no co-payment or deductible. The out-of-network deductible will apply if the scope is done outside of a day surgery network. So if it's done in the doctor's rooms, they are still going to apply. Tonsillectomy management, again, a lot of people just go and have a tonsillectomy done because it's such a common thing, but it really doesn't necessarily need to be that way. So there's a tonsillitis management program where you will get an episode fee for conservative management of tonsillitis by the ENT, telephone virtual face-to-face meeting with the ENT, and that's paid at 100% of Discovery's health rate. The medication that you might need to treat your tonsillitis, the access to the Taito Home point of care monitoring device where you will have to pay up to a certain amount, 75% of the Discovery Health rate, but then you've got it there for any future urgent needs as well. And then clinical entry criteria, guidelines and protocols will apply. Where a tonsillectomy is referred and approved after completion of the program, the deductible currently applied to the priority plans will not apply. Anesthetic preoperative management program. I think this is a great thing. Where now, instead of just going into hospital and having your preoperative management there, which is, you can't really do much in the space of a few hours, they will now have a program for those going for major operations. It's like arthroplasties, colorectal surgery, coronary artery bypass graft, also known as CABG, the radial prostatectomies and mastectomies. Okay, so you're going to be sent a nurse who will do a preoperative assessment for you at home. You can have a telephonic, virtual, face-to-face consultation with a treating doctor based on your clinical risk. Specified pathology, radiology, to me this is a big one, and laboratory tests where required and directly related to the surgery and comorbidities of the member that will be included in the treatment program, and the member's individual clinical needs will obviously be determined by the treating healthcare professional. And then all the protocols as normal will apply. Primary care doctor. Okay, so this one, I'm going to take this one a little bit slower because it affects so many people and it is quite important. All right, so primary care doctors, so your normal GP, manage the day-to-day healthcare needs of a member. A patient's primary care doctor will establish their health history, conduct screening, prevention tests, coordinate specialist referrals where necessary, and also make recommendations to improve the health and wellness. Now, not all doctors, in Discovery's opinion, are particularly good at this type of thing. There are doctors that they have identified that are particularly good with management of these chronic conditions. So you are going to need to, we'll have to send out some lists, and I know Discovery will do that, of the doctors that are in this network of doctors. And even if you are on quite a high plan with no restriction on what doctor you use, they still want you to use this particular network of doctors for your chronic condition, because they know and they've got a proven track record of treating these conditions really well. According to a recent WHO report, patients who saw the same doctor had 13% fewer hospital admissions, 20% fewer visits to the emergency department, and that shows that continuity and coordination of care will improve the quality of care for members with complex healthcare needs. Based on the better expected healthcare outcomes for members, all members registered for the prescribed minimum benefit chronic conditions will be required to nominate a primary care doctor for the management of their chronic illness. So if you've got asthma, you've got high blood pressure, if you've got diabetes, systemic lupus, or any of the PMB conditions or prescribed minimum benefit chronic conditions, you will need to nominate a primary care doctor. The primary care doctor must be a GP participating in the Discovery Health GP network or a nominated GP network based on the member's chosen plan. All right, so what Discovery are trying to do is ensure that those with chronic conditions are actually seeing a GP that is more specialized and has shown a track record of being really good. If you are registered for chronic illness benefit, you will be covered in full for consultations with your primary care doctor and also health care services referred by that doctor for the management of your illness. Should a member registered on the chronic illness opt not to nominate a primary care doctor, or a member voluntarily chooses to make use of a GP other than their nominated GP, the scheme will cover the consultation rate up to 80% of the Discovery Health rate. Key care members must nominate their primary GP from the Key Care GP network, and SMART members must nominate a GP from the SMART network. No co-payment will apply in the event of an emergency or involuntary use of a non-DSP. So if you suddenly have an asthma attack and you are outside of your normal place of seeing your doctor, that will not be charged. Affected members of Discovery Health will receive comprehensive communication in this regard. So you got to get a process to nominate the GP. We'll have changes to the chronic illness benefit following the nomination of the GP, and then the process to change your nominated GP if you want to change the person that you have selected in the beginning. Process to nominate a GP will commence on the 1st of January, but is only going to be implemented from the 1st of May 2022. Limits, copays and deductibles. Okay, so copayments and deductibles are going to increase by 4.5% in line with expected consumer inflation. Your thresholds will increase by 7.9%, which is the same as the premiums. Benefit limits will be increased by 4.5%, again in line with expected the CPI. From 1st of January, with the exception of the following, there will be no increase required for 2022 based on the expected utilization of these benefits. Okay, let me just say that again. From the 1st of Jan, with the exception of the following that I'm going to read out now, there is no increase required for 2022. So these will have an increase: oncology threshold, specialized medicine and technology benefit, your international travel benefit, overseas treatment benefit, optometry benefit, prescribed medication benefit, your dentistry, allied therapeutic and psychological benefit, your external medical items, including hearing aids, and your key care mobility benefit, and then certain surgical items. I want to move on now to a different topic, and I've only got a few minutes left. So Discovery Hospital at Home is actually quite an innovative thing that they are introducing. So for those that qualify, you will actually get a device that is put onto your chest. They will be able to monitor you 24/7 from your home while you're lying in bed in your comfort of your own PJs and your own bed and your pillows, and they will keep monitoring you. And when they pick up something is not right, they will either contact you or they will send somebody to go and see you. So we know, and I'm not going to go through these, but there is all sorts of statistics around how much better the treatment and recovery is for those who have this kind of accelerated digitized patient care. Discovery is also going to lead, along with their partner, a care program for long COVID, because this is proving to be quite a big problem, and there is not a care program at this point in time across the globe for long COVID, so Discovery will get involved there. All right, so they're going to be using a group called, where is it? So let me try and find it quickly. Okay, program enrollment qualifying patients. You have to qualify. Device benefit is in line with, okay, it's going to be paid at 100% of Discovery Health rates if you qualify for this program. Gosh, I can't seem to find the name of the team that they're working with. It'll pop up somewhere. But just another notice that the go live dates will be from the 1st of January. I think the long COVID is going to be from the 2nd of January. And finally, we're looking at the digital patient community platform. Discovery is really pushing all their members to go digital because it is very cost effective and you can do more on the digital platform. So this is done in conjunction with a crowd called My Health Teams. And for those specifically with diabetes or with heart disease, and 22% of Discovery's members actually have both of them. It would really be to your benefit to get involved with this digital online community. What they're going to do is do social networks for members living with diabetes, so you can speak to a number of other people who are suffering the same thing as you are and get information from them. There's also a full-time Discovery and My Health Team community moderator who can pick up when incorrect information is being put across. In-house teams or local and international medical experts will do presentations. Accurate and relevant clinical content will be available online, and also regular blogs and live Q&A sessions to help you with your disease. So there will be, you need to obviously qualify for the program. There'll be an eligibility thing, obviously being able to do digital stuff is one of them. Program enrollment and access will be there, and then your go live dates are going to be 1st of January for the diabetes and the heart disease, and then long COVID will start on the 2nd of February for 2022. So guys, just to say thank you very much for sharing this time. If you need to have a review, please contact me. Absolutely no problem, we can do that. And if you know that, or you suspect you might need to do an upgrade in 2022, please do it before the end of the year. Before the 20th of December, because I need to then do the upgrade for you, because if you do it later in May, you might have used more of your medical savings, and that's going to be a problem. So contact me and we'll see you all again.